All right, thank you, Rachel. Well, UNM Sandoval Regional Medical Center is the first community-based academic healthcare facility in the state of New Mexico, offering expert emergency care 24 hours a day, 7 days a week. Joining us now to talk more about the emergency room and really a growing epidemic that you guys are seeing in the ER are nurses Alex Price and Beverly Carter. So we are talking about something that we're seeing a lot more of, and it's opioids, prescription painkillers, people abusing them, using them too much. How much of this do you guys actually see in the ER?
Well, obviously when it comes in, it's pretty dramatic, but it's the backbone of a lot of other things that we see as well. Sometimes we'll never even know what it is. We certainly know that there's tons of it in New Mexico. We're famous throughout the United States for being one of the states with the worst cases of overdose deaths. And especially where SRMC is, we have a more rural area, and also we know that that's like twice as likely to have deaths in rural areas than
Really?
urban.
Is it because the abuse is higher? Is it that they just have further to drive to get the treatment because they're rural?
There's not as many treatment options in the rural areas. You know, there's support groups, there's family, but it also takes the person doing the overdosing recognition of the problem first.
So let's talk about some of the steps that people can take when they deal with this. Either, you know, they themselves, they may have a problem, or someone out there that has a loved one that is dealing with an addiction. What are some of the things that we can do to kind of quell this and prevent it?
Some support is a major thing, especially with family. Like I said before, recognizing the problem for the individual. There's 12-step programs, there's medications that we can help, but initially it's, you know, education on opiates.
Sure. Well, so Beverly, you bring up an interesting point, the recognition of the problem, because a lot of times a loved one may not know that their spouse, their brother, sister, child, whatever, is abusing. What can we look for in terms of symptoms or behavioral issues that they may have an opioid problem?
There's a lot of subtle things. Sometimes there's some really obvious things that comes to the emergency room. The subtle things are usually grandma is noticing that the prescription cabinet pills are going faster than usual. Often it's a conversation with a doctor. The doctor's wondering why the pills are going so fast, and people in the family who are using prescription narcotics will be wondering why they're refilling them more. Sometimes it's strange things that you just don't connect the dots, sometimes not till afterwards. Fentanyl patches are a big one. People will find them laying around. People have stashes of medications that's not theirs. Empty pill bottles. There's lots of little things. The important thing is trying to make sure that you get information out there early to people before they actually need it or before they get to the emergency room.
Right, absolutely. So obviously if you have those by prescription in your home, be extra vigilant. That seems one of the keys.
Yes.
So we get to the point where someone does have an overdose, they have an issue, they come to the emergency room. What do we do? How much time do we have in terms of, you know, we don't know what's going on, you found them passed out on the floor, whatever. What's the next step once we get to the ER?
It's based on each individual. We don't have very much time dependent on how much narcotics they did take. We do use Narcan. It's a opiate antagonist that fights off the opiates on the receptor sites. That usually works, but it's very short acting, so we end up having to give the patient more. Respiratory distress is a major thing that we have to watch for. So oxygen, managing their airway. Like I said, it's very dependent on the patient and what they took and how much of it.
Critically, we want to know the story, the background to it. Often we don't get that, and we have to try to figure it out from what we do have. But any family or friends or members or whoever drops them off, knowing what happened, even small information can make a big difference in the treatment.
Just the smallest information that we may think is incidental could actually be a life-saving detail.
Correct.
Okay. Just last question that I have for you guys. Obviously, you work in the ER. You work in a very stressful situation, very stressful environments. Have you seen a lot of these come through on your shifts?
Yes, quite often.
It comes and goes, and actually this time of year is one of the worst times. During the holiday season, it's famous.
Why do you think we have such an epidemic here in New Mexico?
If we had the answer to that, then we'd be a long way to solving it. Some of the problems are people can often be on the edge of coping, and then one little thing will suddenly throw it off. Some people will use opiates as a method of coping. Initially, so something simple like coping with a pain condition, but afterwards it becomes a replacement, and then people can't focus when their regular schedule is thrown off, and suddenly they find themselves in the emergency room just from the smallest of things.
Smallest of things. Well, obviously keeping extra vigilant. If people want to get more information from UNM Sandoval Regional Medical, what's the best way to contact you?
Well, we have lots of ways to contact our